there are things that are really core to us, right? So the 6 living principles, it's about heart openness, and it is about the principle of love as a healing force. Love is a resonant field, so nothing romantic, relational, transactional, but actually something that works. So think of health in terms of physics. Think of health in terms of resonant fields, frequencies being in phase with each other, and what does that actually mean? And I think that has been sort of disregarded for a long time in sort of recent explorations of medicine. Welcome back to the heart of healthcare. It's been a while, and that time away was intentional. We've spent the past few years turning ideas into action, building programs, research, and real places of healing through the Heart-Based Medicine Foundation and the Heart-Based Centers.
Now, as we reconnect here, we're reflecting on that journey, where we began, what we've learned, and how this movement has grown. These 4 conversations close this chapter and open the door to what comes next.
We'll look back at how it all started, the journey. Then we'll explore how the principles in action came to life in daily care. Next, how Heart-Based Insights turned into programs and impact. And finally, what's ahead, the future and our invitation.
Thank you for being part of this story, for every listen, every reflection, and every moment of care you've shared.
Together, we're evolving healthcare into medicine with heart.
After exploring the beginnings of the foundation, the 6 living principles in daily practice, and the early impact of our programs, today we turn toward the future. We look at what the next decade of heart-based healthcare could hold, and how partnerships, evidence, and mission-aligned investment can help this movement grow with integrity. Joining us today is Dr. Farhad Riahi, physician and assistant professor of medicine at McGill University, where he teaches and practices urgent care, and at the same time is a healthcare strategist with a long career in consulting and industry. His work focuses on building partnerships across sectors and professions to improve healthcare delivery. Together, we'll explore what it means to scale heart-based medicine responsibly, how philanthropy and purpose-driven investment can reinforce one another, and how all of this can shape the future of healthcare. So Jan, looking back, what do you see as the most important lessons from the Foundation's first years?
Our biggest lesson is that heart and evidence don't compete. They strengthen each other. It's because real change begins when science meets the human heart.
Mm. And how have the 6 living principles shaped the Foundation's culture and direction?
Oh, importantly, they are the foundation. They have become part of how we work, teach, and lead. They're a compass for every project and every partnership.
Mm-hmm. And what is your vision now for the next 5 to 10 years, especially when you think about research or evidence and scaling heart-based healthcare responsibly?
Yeah, we'd like to generate impact. And so we want to expand access to heart-based medicine through data, through education and scalable models, identifying what must stay core and what can adapt as we grow.
Mm-hmm. Interesting. Farhad, you've spent years helping organizations scale healthcare innovations. What stands out to you when you hear Jan speak about scalable models?
Thanks for having me, first of all. It's delightful to be here. I actually love being here at this moment in the life cycle of an idea where there's something that is working. And now the question is, great, how do we get it to more people? Mm-hmm. And so that's where the question of scaling comes up. And that's where I've ended up spending quite a lot of my working life. Mm-hmm. What I've learned in one sentence is you can't scale everything. So you have to decide what are the important things that you want to still be there in the scaled up version of this, and what are the things that need to change. The simplest example I usually give people is you have a sports car. It drives a certain way. If you make it bigger, it doesn't quite do that anymore. It can't, right? It's the same with people. I have a toddler. I have a 2.5-year-old. He's absolutely delightful. He's going to grow up. He's going to scale up. When he's 20, he can't look like a 2.5-year-old, right? The physical proportions won't make sense. But there are things in that 2.5-year-old that I hope will still be there in the 20-year-old. That sense of curiosity, that sense of wonder at the world. And so you want to keep that and say, yeah, his arms and legs are going to be longer than they are now, and his head's going to be relatively smaller. That's fine. It's the same with organizations, both organizations I've tried to work for and help, and also the ones that I've been in when I was in consulting. We started a new practice on working in global health. At the beginning, it was just a few of us. By the time I left, it was much bigger. That bigger thing couldn't work the same way as 3 people sitting in a room saying, wow, how are we going to make a difference to WHO and, the big global health organizations? So that's really what you have to think about. And in a way, that's kind of my question back to you, Jan, which is what is it that really has to be there as you scale up and has to be there again at the next stage of the journey? And what are the things that you're okay to let adjust and change and adapt with the growth?
Such a key question, and I guess we will find out a lot as we go. So the current state of ignorance, I would say, there are things that are really core to us, right? So the 6 living principles, it's about heart openness, and it is about the principle of love is a healing force. Love is a resonant field, so nothing romantic, relational, transactional, but actually something that works. So think of health in terms of physics. Think of health in terms of resonant fields, frequencies being in phase with each other, and what does that actually mean? And I think that has been sort of disregarded for a long time in sort of recent explorations of medicine. So when we look at the last sort of 200 years of research, then most of the discovery was along the lines of, identifying disease entities and identifying syndromes and kind of breaking it up and kind of distilling what could be mechanisms behind this, how might the body work, and describe it, and then to sort of zoom in towards let's say a candidate, typically from the arena of chemistry, right? So the pharmaceutical industry would zoom into what might be a substrate that, what might be a candidate that lends itself change physiology or metabolism in a way that it's helpful. Here, I think we've made fantastic progress, and we've sort of forgotten a gem along the road. It has to do with our inner state to start with, and it has to do with how we relate to each other. So when we think of what should be consistent across different health centers and what might be adaptable, then our inner state is something that actually stays consistent, and that translates into how do we deal with each other as a team. That translates into marketing. Is it a push marketing or is it magnetic? It translates into how we see patients, and I'm saying patients now and hesitate because do we really want to see fellow travelers, fellow humans as patients? Is that really the kind of paradigm we want to hold up? Like we're the carriers of the solutions while you need to patiently, paciencia, wait, right? As a client, or do we actually meet at eye level? And so how can we actually, this is where the infectious disease person comes in here. So how can we infect others with our inner state, right? Is that an infectious thing? And how can we give patients or humans exploring life and health with us together, how can we give them permission to take the same inner state that we wish for us to have, and what happens if we then meet in that space, right? That's the how around this is the 6 living principles that we talked about in a previous episode. But that's a key thing. Now, of course, they're not the same people in every health center, right? So, like Andrea is working in the health center in Basel, right? And so we can't clone Andrea, as you said, for your son, right? So that's impossible. She's unique, and it's that uniqueness that we want to find in another location. So somebody who has qualities and capacities and abilities in their own uniqueness and harness that uniqueness, if you like, for the idea.
Yeah, there's a lot in what you said that resonates with me. But this particular point, it is about a way of being, and therefore it's about people, I think is very powerful. I've experienced a related, I would say sort of weaker form of it, but related in my work as a management consultant at the time with McKinsey and Company. One of the things that surprised me and delighted me coming out of medicine into that world was just the extraordinary amount of time that the senior leaders spent on recruiting, development, feedback, thinking about career development, career progression for everybody in the firm. It was just enormous amounts of time. And then when I became a partner myself and I was doing it, I was spending enormous amount of time that I could have been spending on, client development or sort of making money, so to speak. But that was a core principle, a core value of the firm that I experienced, which is this is about people, and we are going to spend an inordinate amount of time finding the right people and then helping them to develop as best we can. And whether they stay or whether they leave, it actually doesn't matter. They are going to have an experience of there are people here who care about them. Mm-hmm. The performance standards are high. It's a tough place, but the people are caring. And that you can scale from practice to practice, from office to office. It requires an enormous amount of discipline the bigger you get, because you get more and more people, it becomes more and more diverse. But the idea that core here is the people, and that's where we're going to spend a lot of our time and investment in thinking about development, is something that I've seen works and I've seen can scale. So I think what you're describing, which I feel is even more powerful, would be amazing to scale.
It would, and it's fascinating to me that you're describing this from a different industry, right? So it's true not only in the health arena, but in other arenas, right? So what is sort of the essence for us? It's
the secret sauce.
Yeah. The essence is presence, evidence, and human connection, right? Everything else can evolve. Everything else is flexible, and then the question is, how can we anchor this?
Yeah, everything else is then tools and techniques and processes and skills and things that you can learn. How to be a consultant is different today than when I started, 20-something years ago. We didn't have AI. So the skills are different. But that core of the people and what you're trying to do with a client and how you behave with your colleagues.
Let's just quickly shift to clinicals. So when you think of hospitals, when you think of outpatient care, when you think of health centers, when you think of public health arenas, right?
Yeah.
So whether you think of public health agencies, and on and on, you go through the stakeholders, right? It's not common that there's a conversation about inner state. It's not common there's a conversation around culture and how do we create a culture in a meeting, in how we interact. Right? How come? How come that, particularly in healthcare, this doesn't seem to be a very conscious thing? And it's even worse. It's consciously neglected in terms of, but that's a given,
Don't get me started. This is one of the things that sort of partly drove me out of healthcare in a way, right? Because I was there seeing patients, doing my job. I read my books, I learned from my mentors and people, and I was seeing my patients and doing my thing. And it's like, you know what? Doesn't look that great. Outcomes aren't that great. People aren't that happy. I can read Harrison's Principles of Internal Medicine, and I can read Tintinelli's Emerge. I can read them back and forth, and there's not a jot. There's nothing in there about
human interaction.
This other stuff, yes. Right? So I had to go outside. Probably the low point of my experience was as a medical student on a gastroenterology service with two gastroenterologists, two professors of medicine of gastroenterology, who, no pun intended, hated each other's guts and refused to coordinate how they took care of patients. So this poor chief resident was running around as the go-between between these two guys, put the NG tube in, no, take the NG tube out, start steroids, no, stop steroids, do these labs, no, do. And as you say, everyone was just carrying on as if this was perfectly normal. Yeah. I'm sorry, this is not normal. It cannot be normal.
Right.
There are examples on the other side, right? You also get these pockets of absolute excellence. It really just seems to depend on the individual leader and what they decide to create.
And isn't that a place where change is needed, starting from education?
And
right?
then, yes.
Why do we leave something that is so fundamental, that research shows that it's more than 50% of the therapeutic alliance, if you like? More than 50% of what works is how we relate to each other, which means it depends on how we show up.
Yeah.
And it's sort of systemically, let's say it's widely disregarded.
Look, the honest answer is that I don't know the full answer. I have picked up a couple of things. One, again, as I said, is it does depend a little bit on the leader of that particular group, and then it's a matter of luck. Then you've got a question of, well, how do people get into those leadership positions? And then that kind of depends on their leaders. And then it's a bit a question of scale. In a place that is big enough, you can get away with it. In a smaller structure, you wouldn't. Again, and I have my own experiences from consulting where people were not elected partner, even though they were, quote, delivering, but the feedback from their teams just wasn't good enough. And so it wouldn't matter how much money they were bringing in. They were not going to make it. In some places, that holds. Once things get very big, people can kind of slide through, and that's kind of the beginning of the end at that point. So I think scale does come into it, and that's why this question of scale, how to scale, is so important. The other thing, and I think sort of everyone knows this, is what is easy to measure gets managed, right? And this stuff is not easy to measure. You know better than anyone else. I'd love to find the single biomarker that, goes up when there's a real connection between people. So, but those are some of the things, at least, that I've observed that make this difficult.
That's for another episode. We're going to talk about that. That's a whole different topic.
The Bonhoeffer biomarker.
Without a name attached to it, something useful. Even if we could get somewhere near, as in some of the other medical arenas where objective measurements seem helpful, even if there was a complex of biomarkers, even if there was a set of biomarkers that as a compound outcome delivers something, that would be massive. Until then, we need to rely on N of 1 subjective evidence as a gold standard, right? So it's, how do you feel? What does it feel like? Yeah. And how does it feel to you? And let's compare notes. And then that's where it is. And that's an interesting sort of methodological challenge in pain research, right? How do we actually take something that is hard to measure as a gold standard? And how do we build methods based on that, and are they valid? And I think there are arenas where we've seen that they're valid. And one of the key questions also in terms of scaling would be, how do we measure the consistency of that across sites, right? So imagine there's 10 health centers or more for that matter, how do we know that there is a similar culture lived and there's a similar approach lived? And what are the KPIs to be measured here, right?
Yes. What are the KPIs to be measured, and how do you adjust their measurement? Again, practicing in a very multicultural environment, there are some people that I can very simply ask, at the end of our time together, did you feel heard? Did you feel like this was a good encounter for you? There are other people where if you ask that question, it's very difficult for them to answer it in the way that the first person would have. And there's some other way to have that discussion, but you need to know what that is, right? That feeling is the same, but it will reflect differently if you're speaking to an old-time English Canadian, than a new immigrant from Vietnam, than one of our First Nations, coming from our First Nations communities in the north.
Yeah, it requires sensitivity, doesn't it, to each individual situation and each individual person?
Yes.
So what patterns or lessons stand out to you specifically, Farhad, when you think about collaboration across sectors?
Collaboration across sectors is, in some way, exactly the same as collaboration within sectors, in the sense that it starts with actually understanding what it's like to be that other person, who they are, and what they're trying to do. It's usually easier within sectors, right? I have a reasonably intuitive sense of what my fellow physician is going through, and something else like that. Across sectors, you need to take a little bit more time and have a lot more humility. The fundamental principle is the same, of trying to put yourself in the other person's shoes. One of the problems that we have as individuals is, I'm here. You would be amazed what a rich, detailed, nuanced, subtle view I have of me. Right?
Well said, yes.
And what a simplistic view I have of the person I'm, right? In a doctor-patient encounter, I'm not just a doctor, I'm all of me. Mm-hmm. This person is another patient, right? And they're kind of simplified to
their kidney.
Patient, male, this age, this organ, this whatever. And then cross-sector, it becomes even worse, right? Mm-hmm. I am part of the tribe of people who is out there to help people get them healthy. That insurance company executive is a caricature, right? They're just there to, make money or, prevent services from being delivered. Mm-hmm. Absolutely not true.
Many assumptions.
Right, many assumptions. And then the further away it gets, the worse it gets. Like politicians, don't get me started. So this capacity for really trying to understand who they are, why they're there, what they're trying to do, what their constraints are, what their opportunities are, why they're sitting at the table talking to you, that for me is key. Because once you've done that work, then you can have a conversation with the other person, suddenly makes them stop seeing you as a caricature, because it works exactly the same way the other way around as well. Yeah. Right?
That's that resonant field, right?
Yeah.
That's when you give the other one permission to be a sovereign being.
Yes.
Then it changes the conversation somehow. It's the way that's the magic that happens, if you like, is the way you listen changes the answer. That is just so strange.
Yes.
If you ask the same question 10 times, it will be the same answer, but it depends on your inner disposition.
Yes.
On what you will get back.
Absolutely. This is intuitive to us in clinical practice. If the patient trusts you, they will tell you what's really going on with them. They will tell you the stuff that they won't tell someone they don't trust.
And if they tell you if they trust you as a specialist for a certain issue, then they will tell you everything around that issue. If they trust you as a human being, then they tell you other things too.
Yes, yes.
And that's not the same thing.
Those are not the same thing.
Yeah.
No, exactly. And that at least I have found, anytime I've been able to make or help make that connection, the conversation has gone in a much more honest way. And that's the other part of it, right? You may find after an honest conversation that actually there isn't much for us to do together. And that's fine. In fact, it's much better to know that and not get into partnership than kind of try to yoke ourselves together and find that we're pulling apart all the time, right? Or we may find that, hey, actually there are things that we can do together, and this is worth trying. Yeah. That's it. Put aside all the caricatures and received ideas and, typical pictures of what the other side is. Just engage openly and find out.
It's fascinating that when we talk about this knowing sort of aspects of clinical work and knowing aspects of building a business or a corporation, that typically when it's about business development or it's about finding investors, finding funding models, it's very hard to convey that this is not just important, but it actually is an effective thing to do, and it's an efficient thing to do. It's an economic thing to do, right? But it's hard to measure, so it's hard to communicate.
Yes.
What is your experience here when we think of creating an environment that is healthy for both the healthcare professionals as well as the patients? What is your experience here in terms of who's interested in this, other than the patients and the healthcare professionals?
Let me give you an example actually from my industry work, which is of trying to build partnerships with governments and public payers and public providers, coming from a very funny position, right, as a representative of a pharmaceutical company. This all looks very odd. I have, in all of my attempts, some of which worked, many of which didn't, I've never found a situation where genuinely nobody was interested in this. I've always found people who are interested. Sometimes we didn't because the interested people just weren't in a position to act. They were about to leave office in 3 months. Their political party had gotten voted out. Sometimes they were too junior. They didn't have power. But especially when it comes to healthcare and things that help people get better, I'm an optimist. I'm an experienced optimist because I've always managed to find people who care. Not many sometimes, but they're there. And so that's why I think this is worth doing. But you also then have to be realistic. There will certainly at the beginning be only a few of them. It's the equivalent of the early adopter, late adopter curve. And it just takes a lot of knocking on doors and meeting people and saying, well, who else should I talk to get there? It's just hard work.
Yeah, and let me pick up on the investment question there. What are your thoughts around mission investment? Do you think that marrying philanthropy with purpose-driven investment works? Can it be successful?
I don't know yet. I think there are examples, yes. Certainly, I think, as Farhad said, there are examples of public-private partnerships. There's certainly examples of foundations fueling areas of healthcare. It depends a little bit on how this is done. What we're trying with the Heart-Based Medicine Foundation is, what we're working towards right now is that the interest of the foundation is public health impact. If that is more than a theory, if that is to actually land somewhere, there has to be personal, individual health impact at some point that then occurs on scale. So that impact is best delivered through health centers, we feel. So the foundation is interested to build a network of health centers and to help fund that. The way a foundation can do this is attract donors or, let's say, purpose investors, so those that are more interested in the societal impact than in their financial return of investment. When we look at a health center and we look at the format that works best is a corporation, then there are other financial rules and regulations around that. And so the question would be, is it possible that a corporation can actually run as a corporation, like a C Corp? So it has a financial interest, it pursues a financial interest, but not for the sake of it. So then the question is, what are models of steward ownership versus shareholder value ownership? And here, the question is, what is a good model for a health center? And then what might be a good, almost like a circular collaboration between a philanthropic entity like a foundation and an entity that should be self-sustainable, and therefore it should make profit. But then how does it deal with the profit? Does the profit go back to the foundation, or is it invested in building more centers, which is probably more in the interest of the foundation, right, to actually propagate? These are the models we're exploring right now. And we're kind of having these conversations that Farhad is talking about, is where are foundations, people, fellow human travelers again, right, who do see the urgent need of an evolution in healthcare here, and who see the benefit and who see the sustainability of such a model, considering that right now, in many countries, healthcare professionals are running away in droves, right?
I can say a few things about that from what I've seen. Actually, I'll maybe give 2 examples. One is a company that I myself have invested in that was started by a former colleague of mine in Spain. In Spain, it's a B Corp. It's not a C Corp, but it's the same idea. So my friend Uriol had this idea of, on the one hand, we need to deliver better home care to people so that they can either stay out of the hospital or get out of the hospital more quickly and be cared for at home for the elderly population or people after a major medical or surgical event. And on the other hand, in Spain, there is a large network of informal carers who are kind of hired here or there to do that, who do this work but have no professional status, have no continuing professional development, are not recognized as such in society. So he started his company with the 2 goals of improving home care for people who need it and essentially professionalizing an entire group of people who provide that service. And this is the social mission of the company. It needs, and for it to work, it needs to work at scale. So he started in Barcelona, then Catalonia, and then now sort of all over Spain. And the funding has been venture funding, but it's always been a mix of venture capital with a social mission, other funds from government and other places that are more interested in the value of what's being created. They don't particularly want a financial return. So he's found a blend of investors that get along because they all buy into this. And that's what's going on. And he just raised actually the 37 million, the biggest fundraising for that kind of company in Spain. And he's a good guy.
Yeah.
So that
very encouraging.
so that gives me hope. The most extreme version of this that I saw, which was, I thought, a fantastic idea, which ended up not working for other reasons, was private equity funds out of the Middle East working with big philanthropists working out of the US to build healthcare infrastructure, East Africa and Southeast Asia, serving the lower part of the socioeconomic pyramid.
Okay.
This I thought was really clever because economically at that part of the pyramid, you can't generate the economic returns that private equity needs to give back to its investors. At the same time, if you don't build that infrastructure, you can't generate the health outcome improvements that the philanthropists want in terms of increasing access to surgery, better maternal and child care. I mean, these things need hospitals, they need clinics, they need kit, they need equipment, right? Yeah. You don't sort of fly in and do something and fly out. So this model was, okay, we both put in money, you've got this pot of money. The private equity guys take all of the financial returns, because that's what they care about. The philanthropy guys take all of the impact returns, which is what they care about, and the other guys don't care about, right? I mean, it's nice, but it's not there. So that, I thought, was an interesting model, and I would be quite keen to explore versions of that here and in other places as well.
Sure. So what advice would you give to the Heart-Based Medicine Foundation and the Heart-Based Centers about combining that level of philanthropic capital with venture investment?
I'm always loath to offer advice to the people who are actually doing it and learning. And I'm kind of standing out here going, hey, that looks really cool. So I would probably rephrase it as, here's what I've learned from my experience. I offer, you can take it and play with it as you will. It is possible. It takes a lot of work to go and talk to enough people to find the right people, but they are there. And it's important to be really clear about what the vision is and what you're trying to do, and not dilute it or tailor it because you think that's what's going to, if I move a little bit in your way, maybe.
Palatable.
Yeah, that has not worked in my experience. But being clear about what the vision is, and I think as you're doing, backing it up with evidence in all of its forms, anecdotes, examples, qualitative reports, then quantitative. And the more of it there is, the more people will engage. That, I think, is the journey.
Farhad, you are clearly supportive of the work that we're doing here. Thank you. What moved you to get involved in the beginning, and what impact have you seen?
For me, this is an interesting convergence of several different things in my life. I mean, I think, as I said earlier on, the starting point for me was just as a practicing physician, hey, this stuff isn't working. Let's go figure it out. Yeah. As I've grown older and been a patient myself a couple of times, hopefully, luckily not too many times, I've had the reverse experience as well. As a physician patient, I'm reasonably empowered. The difference between an encounter where I felt heard and actually seen and cared about, and one where I didn't, independent of the technical outcome of the result, is I can feel it. It's obvious. Yeah. So if I can feel it, imagine all my patients feel. So those two things. And then the third thing is I've spent a lot of time, as you've heard, trying to figure out how to fix the system in a sense. And I have slowly, I can be slow, come to the realization that it's very hard to move bricks and mortar and money and incentives and stuff. But actually, one of the ways to improve the system is to work with the people who are in the system, because actually the people are the system.
Yeah.
They're the ones who make the rules, right? That's then the latest reason I've come to this, which is why I think it's so important to scale it, and which is why I think it has so much potential. Because I see it all the way from the experience of an individual patient and the experience of an individual physician to actually this is a lever for changing the way that we do healthcare. For all those reasons, I'm all in.
Big vision. Thank you. And Jan, how does the Heart-Based Center contribute to this vision?
It's where the rubber hits the road. So it's where philosophy meets reality. It's where science meets heart, and where healthcare professionals meet patients in a way that they enjoy it, where healthcare professionals meet patients on their terms, and where patients meet healthcare professionals on their terms. And it seems to be that this is a space that can be created. It is a space, if we create an enabling environment, then this is facilitated and it's possible. And I think that's the contribution that a health center can bring.
For sure. And finally, Jan, how can listeners support or become part of this movement?
Healthcare is for everybody, right? So everybody can contribute. Everybody can contribute to their own health.
Yeah.
It is possible to join us, to partner with us, to work in the centers, to collaborate on the foundation. There are many questions we're trying to address and to solve. We see us as learning entities, as learning and evolving organizations, rather than those that know and have some ology or philosophy.
We're still dynamic.
So I think the more hearts and hands join, the more impact we can generate.
Wonderful. Thank you both.
Thank you.
Thank you.
From a small idea to a growing global movement, this is just the beginning. Together we can make medicine more human, more connected, and more effective. One conversation, one act of care at a time. Thank you for joining us for Heart of Healthcare. These conversations remind us how far this movement has come and how much heart and presence still guide the future of medicine.
What began as a reflection has grown into research, education, and real-world care through the Heart-Based Medicine Foundation. Each story, each voice is part of that unfolding.
And as this chapter closes, we invite you to stay with us as we continue exploring medicine with heart.
Together, we are learning how heart and science can heal not only medicine, but humanity itself.
To learn more or support the foundation, visit heartbasedmedicine.org.